ready. Hello friends, my name is Mindy Benson and I'm a person who has recovered from a substance use disorder. And welcome to the 7th annual Walk to Remember. I just want to personally take a second just to thank every single one of you for coming and walking today. The people that you've lost to the disease of addiction matter to me. The people that I've lost matter to me, which is why I started this walk. I started this walk after I lost my sister and I buried over 40 clients to addiction. And every single one of them deserve to be remembered every day. So at the end of this walk, at the end of the rally, I would love it if you'd share your pictures of your loved ones because I want to know their names, I want to know about them, and I would love to share my people with you as well. So we're going to take this walk around this path, around the back of the Capitol to the east door, where we will then go in to join the Rally for Recovery. And we're off. Woo! What do I do with this thing? Okay. I'm like, it's like 40 pounds.
It has a shoulder strap, man.
I get so nervous.
Hey, Mindy, I'll catch up with you.
Okay.
Film Mindy.
Yes, where is my children?
Mindy's,
They're hiding. I'm like,
Mindy's videographer today.
I'm not even photogenic. There's so many friends who are.
Stop it! You are such a liar! You're so cute. Where are my children?
You don't believe it. There they are. Okay. I will send you the link.
I like it.
I don't think that is
Say hi!
Come on, Humphrey! Make sure you get Humphrey because he's going to walk so long.
Humphrey!
That's him. Oh, gosh. Dude, it's so
Everything else will. Police would love to get things better again to where it was a we can visit. But,
Breaking right. Sorry, I'm the worst walk ever.
You are the best motherfucker! I can't get my phone! Are you so hard to say you guys are birthday?
hey, how you doing?
Hey!
Yeah, so I feel fortunate to come out there alive.
Yeah.
Of course, George is going to climb the fence.
Now we're rallying.
Now we're rolling. Wave, hey!
You can reconcile that. You got a curriculum all set up.
Oh,
From the past. You just kind of took that. Highly
highly. Say hi.
It's okay, though. It's okay.
That chunky dog is
her agency's been already point. But she's writing an article for the
Say hi! Yay!
horrible how we phrase. You don't look at that chart at all. We don't even hang that damn poster. And when they say I'm anxious, oh,
Say hi, Mark.
good to see you.
Good to see you. Hi.
Click this.
I'm just gonna pick like Chris's little one.
Yeah?
How are you? I'm Sam.
Hey, I'll take that. I feel so special with you right now. You gotta jump over that jumps my God.
Yeah, but
I know the fair
my shoe. Thanks, Carissa. Teamwork. Hi, Michael. Hi, how are you doing? Huh? I'm doing good. How are you?
Wait, where'd our boy Epic go? Epic, drop that. Oh, no, you don't get lost.
When it's hot out, people don't want to come in and
Say hi.
Hi.
There's Dino. There's Tiffany. What's up there, Coaster? Christian? I'm going there, brother.
The easier soccer ride, Mary Jo.
I can stand outside.
Okay.
Well, let me know how it goes. And I'm proud of you. Don't get in your own way, like I said.
Good, I got my bracelet on for medal. I know.
Reptiles.
We got a place now too, so
Well, we move and they remember our friends and loved ones and family members. I'm good. I'm good. And suddenly planted by Mitch. And it was...
no more.
No more.
I had 2 Not very many people come off. Watch out! Just put those in today. Just got those in.
I noticed that. Did you, Teresa?
I'm sorry. I don't even know.
It's okay.
We've seen in someone on TikTok. I'm sure did.
TikTok.
Yeah, that's what I said. I'm on it now. Yeah. Feeling it right now. Regardless of how it is, you ever talk to your family? Yeah? How is it?
of like trim it up and then that's up front. Okay, we're ready to go.
How'd it go?
Okay. Overflowing people, right? I know, it's so weird.
I'm probably going to give this some extras too, just because I want to try and see it. It is so good. Is there a certain kind of chocolate which I can do so I can mix it up with all of them? I know, right?
I'm over here trying to see.
Well, yeah, I have an idea to mix it up.
Do you want to sit on my lap? Yeah, because I've been
Yeah, I made those last time. I made those under an hour. Yeah, I can involve one of our huge horror fans, and she only likes white chocolate, so I made them over.
What's the one animation show?
Came straight from HR.
My friend used to get cakes and stuff like that. Stick person. An animation show. I can remember it. Buys candy and stuff like that. She's like, you would really need things.
Yeah, and it's fun. Like, I found a new baking store yesterday to try out the sugar because I was trying to find real white chocolate. And that's where I found like these skull molds. And so those skulls on the south picture, that's just the chocolate. So, but I have some hearts and stuff too. Heart mold. And so I'm going to make some heart mold with those words.
Yeah, I don't want to put skull on it.
Yeah. Yeah, no, yeah, it'll be the hard stuff.
Knock roll? Hey, Evan.
Teresa, do we have a lot of people and stuff? We'll be okay. I think we don't. How far away is your car? No, don't worry about it. I'll go get that. No, we need to start in just 2 minutes. Huh? We start in 2 minutes. Well, who starts this? It started. You're gonna edit that, right?
Hello, everybody. So we're just about to get started, so people would take a seat, start calming down. We'll get started here in just a minute, okay?
Hey, Carissa.
What?
She wants to meet the lady in the blue. She wants to meet her.
She's like, whatever, I hate it.
Everybody, could we please have you take a seat? If there, we should have enough that are available. And because we have a acoustically challenging venue, it would be really helpful while our speakers are talking if we would keep the side conversations to so that people can be heard. And with that, we're just about to get started. I see a few people filled with USARA, and I'm going to turn this over to Evan Doan, USARA's development director.
Hello, everybody. So my name's Evan Doan, and I am a person in long-term recovery from a substance use disorder. I want to welcome all of you to our 2022 Rally for Recovery. So as Mary Jo mentioned, I currently serve as the Development Director for the Utah Support Advocates for Recovery Awareness. Our mission as an organization is to connect and inspire communities to advocate for addiction recovery. We envision a Utah where recovery, community, and connection are seen as the most important assets for people to recover from addiction. We're a nonprofit recovery community organization, and this year we just opened up our 5th Recovery Community Center in Moab, Utah. So we're going to have a slate of amazing speakers here today. I'm really excited to be here, to be doing this event in the midst of what's still an ongoing pandemic. I really appreciate the folks that came out today, the folks that are watching on our live stream. As Mary Jo mentioned, if everyone could try to keep the side talk to a minimum so that we can hear everyone, that would be excellent. So first up, I'm going to introduce Rob Westman, the Executive Director of NAMI Utah.
So as Evan said, I'm Rob Westman. I'm director at NAMI Utah. So I'm just going to share really quickly. So, you know, I've been doing this work for quite some time, and I will just tell everyone that this has been a pretty rough week for me. My mental health is not awesome at the moment, but coming here, walking with my little luggage down the sidewalk and such, I knew I was coming in to see folks who understood what I'm going through right now, and I'm like getting goosebumps right now because I feel so much better. So thank you all for being here. The other thing I want to say is this is so important because this provides voice. And if we don't have a voice, we don't get anything done and nothing improves. And I know that it's frustrating. Like we were talking earlier, there was a bill that came up in session, and a lot of people, you know, they testified against it. It wasn't a good bill, and it was passed anyway. And we're just like, what is going on here? But we kept at it, and folks worked behind the scenes, and they did some stuff, and so we got a chance to pull it back, and we're going to work on it. So in that moment, it seemed really frustrating. Like nobody's listening to us, and this is pointless, and why should I do this? And I think what I'm saying is a lot of times we don't get what we're hoping for, but it's so important to do it anyway because no one else is going to do it. Like we have to. And, you know, because if we don't, there are a lot of people that will be glad that we don't because they want it a different way. So thank you again all for being here. And yeah, I think that's just thank you for everything that you do. And I think we have got someone. Do you want to introduce? Okay, thank you, everyone.
All right, so first up I'd like to introduce our first elected official who's going to be speaking today. He is an amazing representative and has done some really incredible work on behalf of Utah's recovery community. Representative Jim Dunnigan.
It's great to be with you this afternoon. So 6 years ago, I sponsored legislation. It's called Targeted Adult Medicaid, and it provides Medicaid for 1 year for those in substance use treatment in the drug court. It was a real battle to get that through, but I know that many people have benefited from it, and so it was worth every challenge. The past 6 years, I have volunteered in Salt Lake County Jail to help people primarily in there for addiction issues and try to help them see that there can be a better path, help them get employment, housing, and get on their feet when they get released. I love doing that. This year I have a bill that I'm working on with Noella Sudbury. And I'm actually going to so Noella and I have been working on this. We've been like a team wrestling team. So anyway, I want Noella to tell you it's not across the finish line that we just sent it for numbering today, but I'm going to let her tell you what the bill does, and then I'll make a comment.
Okay, I'm Noella Sudbury. Hello, everyone. I am the Executive Director of Clean Slate Utah. Clean Slate Utah is a nonprofit organization that was formed to raise awareness of Utah's Clean Slate law, which went into effect today. Recovery know the barriers of a criminal record, and they know how hard it is to get through the expungement process. Utah's Clean Slate campaign started 5 years ago, and it started with your voices. Because of your stories, we held our first Expungement Day event in 2018. It was an amazing day where we tried to streamline the process into 1 day, and we were able to help close to 200 people. It was a really great start, but you told us it wasn't enough and that we needed to do more. So next, we started an Expungement Navigator program at Salt Lake County. That program continues to be a terrific resource for people, and since it opened, has helped over 2,000 people get their records. We made a lot of progress with the Expungement Navigator program, but you all told us there was more work to do. So next, we organized a Clean Slate campaign to try to automate the process. People weren't too open to it at first. It sounded hard, it sounded scary, it sounded very different from the system that we had. And you know what made the difference? All of you. Your stories persuaded law enforcement that people recovered. They persuaded the business chamber that talented people with records are left out of the workforce. They persuaded every single one of our lawmakers who voted unanimously to pass Utah's Clean Slate law. That is power. Today, the state of Utah began the process of automatically clearing not 200, not 2,000, but close to 500,000 criminal records. clearances for so many people who need them. And it passed because of your stories. Clean Slate Utah stands with you. We are ready to help people understand who qualifies for automatic clearance and help connect people to free and low-cost legal resources. But we have even more work to do, and that is why Representative Dunnigan is here. Representative Dunnigan and myself and all of you have told us that while automatic clearance is transformative, not everyone is eligible. And many of you have asked, well, what can you do for people who still have to go through the petition-based process? Well, Representative Dunnigan is running a bill. If any of you have been through the expungement process, you know there are a lot of government fees associated with that process. Those fees keep eligible people from moving forward with their lives. So Representative Dunnigan is running a bill that will do two things. It will eliminate court filing fees for all expungement petitions. And second, it will eliminate BCI certificate fees. Combined effects of this bill will be transformative. It will make it so the only fee you pay to the government is the $65 application fee to BCI. So huge hand for this law.
So I'm not going to say much, but Noella's not quite as tall as I am, but she has a lot more energy, okay? She's a real driver. She's wonderful to work with. She works really hard. She's really smart. And I'm just so pleased to work on this. The bill should be numbered today or tomorrow. And we need all of your help. I'm trying to eliminate all but the initial $65 fee, not $65 per charge or whatever, and then also the court fees, so that you can get back to work and you can have a productive life. Our state desperately needs people to, we don't have enough workers. When I go to jail each week, you know what I see? A labor force. That's what I see. People willing and able to work, and we need to get rid of these barriers that prevent them from doing that. So thank you very much, and thanks for your time today.
Thank you, Representative Dunnigan. That's amazing. So next up, I want to introduce a person who's going to just speak quickly about the Walk to Remember that just happened on the Capitol grounds. She is currently the executive director of the Utah Harm Reduction Coalition, and she is one of my heroes, and I'm lucky enough to call her a friend. So Mindy Vincent, please.
Everybody's faces, even though we're missing like at least 500 people who are usually here. I'm so happy to see the people who are. My name is Mindy Vincent, and I'm a person who has recovered from a substance use disorder. April of this year, I will have 15 years free from chaotic use and my life being a living dream every single day. And I am incredibly grateful for that. 8 years ago, almost 8 years ago, I lost my sister to an opiate overdose. And when that happened, two things happened. One, I wanted to start the Walk to Remember, and Sarah and I started the Walk to Remember 7 years ago to honor the lives that have been lost to the disease of addiction and the substance misuse. And the other thing that happened is that I found harm reduction, because my little brother was still in active addiction when my sister died. And I'm going to try not to get emotional, but we're talking about my siblings here, and my sister is dead. She is never coming back. People talk about overdose like it's a single event, but I'm telling you what, that's the beginning of the entire story, because I have had to celebrate 7 Christmases without my sister. My daughter has graduated kindergarten, my son has graduated high school, all without her. And so for those of you who've lost somebody to this disease, I feel your pain. And I understand that it wasn't an event that happened. It's a lifetime that we have to live with without our loved ones. And I was desperate to save my little brother's life, and everything that I had learned in recovery was not working. I tried taking him to meetings. I introduced him to some of the best heroin addicts that I know. And even though he related to their story, it wasn't what he was looking for. And in that moment, I learned what it meant to really meet somebody where they were at. Because I too had internalized the stigma and the bias that has continued to be perpetuated today. That people who struggle with addiction need to be punished, that they have to hit rock bottom. Rock bottom is death for many people. If punishment and coercion is what worked to get people sober, our best outcomes would come from the prison and people experiencing homelessness. And they have the worst outcomes of everybody. So what we're doing isn't working. It's getting better, but we have a long way to go. So because I was desperate to save my brother's life, I was introduced to harm reduction. And when I first heard about harm reduction, syringe exchange programs, overdose prevention sites, otherwise called safe consumption sites, I was horrified just like everybody else, right? But then I started really reflecting on my own experience and thought about, wow, what if things had been different for me in active addiction? What if somebody had loved me instead of punished me? What if somebody had helped me be a mom instead of taking the only thing that mattered away from me? What if people stopped locking me up and taking my job and my housing and everything and actually gave me those things and helped me learn coping skills so I could succeed? And then that's when I founded the Utah Harm Reduction Coalition. Yes, we should treat people with Addiction is not a criminal issue. It is a public health issue. And at this point, it's bordering on a human rights issue sometimes. We can't continue to mistreat people in hopes that it's going to help them get better, because it's not. Love is the answer. And there has never been a time that I look back over all the people that I've lost, my sister, my clients, I've never looked back and thought, I wish I'd have been tougher on them. I wish I'd have been meaner. Maybe if I had tried harder to make them suffer, they would have changed. I've never ever thought that. I have thought that I wish I would have bought my sister those concert tickets that I didn't think she deserved when she was alive. I have regrets like that. As a clinician, I've thought about times that I have made somebody feel like their recovery wasn't good enough for me. And I will never sit at another treatment team table again and bargain for somebody's worthiness to be in treatment. Regardless of somebody's relationship with substances, we need to embrace people, we need to love people, and we need to save lives. If you want to fight about the rest of it, I'll fight you outside after. In a loving way, I don't really fight people anymore. But we do need to save lives, and that includes having our voices heard. I was just as worthy in active addiction as I am now. I did not gain my worthiness the day that I got sober. My voice matters then, my voice matters now. And your voice matters, and the legislature works for us. Those are public servants, and we need to have our voices heard. We need to support legislation like the Clean Slate Law and the expansion of that law. We need to support harm reduction, including medical cannabis as a harm reduction tool. We need to support overdose prevention sites so people's children don't die in a bathroom at Pioneer Park. We have safe consumption sites currently. They're called bars. We can do the same thing for people who are using drugs. And just so you know, millions and millions of people have done injections, smoking, whatever, in safe consumption sites. No one has ever died in the entire world in a safe consumption site, meaning that safe consumption sites are the #1 preventer of overdose death in the world. And that bill just got killed last week in committee. So please, reach out to your legislators. Tell them you want them to support that good legislation that doesn't harm people. And tell them you don't want them supporting legislation like drug-induced homicide legislation, which continues to hurt more people and perpetuate the war on drugs, which has already taken enough lives. I am so grateful to be here today, and if nobody's told you that they love you, I do. And your recovery is enough for me always, and I will help you, no matter what your relationship with substances is, I will help you, and I love you, and thank you for letting me be here today.
Thank you, Mindy. That was awesome. So I'd like to introduce our next speaker. So just before I say that, though, I want to mention, when I opened today, I mentioned that USARA has 5 recovery community centers across the state. So we've got one in Salt Lake, one in Ogden, one in St. George, our newest one in Moab, and one in Price, Utah, in the middle of Carbon County. And so our next speaker comes to us all the way from Carbon County to speak to us today. So I would love to introduce to you Mercedes Morgan.
I always have to do that no matter where I go. Thank you, Evan. As he said, I am Mercedes Morgan, and I am a daughter and a sister and a wife and a mother and a confidant and an advocate and a woman in long-term recovery. Today I live and practice courage, honesty, grace, kindness, compassion. And Brene Brown once said, grace means that all of your mistakes now serve a purpose instead of shame. And when secrets are told in safe places, shame loses its power. I show up no matter what, because I live my life with integrity today, and that's something I have because of my recovery. I've been with USARA for a little over 2 years, and the amount of growth that we've seen is tremendous, not only in Carbon and Emery County, but statewide through all of our different locations, and the work that we do is amazing. And throughout our different locations, Evan mentioned that we have 5. Last year, we were able to provide 5,316 one-on-one coaching services. That means that 5,316 times somebody reached their hand out and we met them there with no judgment, with nothing but love, kindness, and compassion, and we are helping people to pull themselves out of the trenches. We get to do that today because somebody else paved the way and did those things for us. That's why we're here. Because somebody else held out their hand and showed us a way that was different. Every single one of us deserves to live a happy, healthy life, no matter what your story is, no matter what your circumstances are. I talk about if we all sat in a group and we shared the most horrifying things that we would never share with anybody, we would end the group laughing at lack of originality. Because we all share the same feelings. Right, in substance use disorder, and now we get to share feelings in recovery. Every single one of us deserves a life that we get to cherish, that we get to be present for, and not have it pass us by while we simply exist. I will not ever be known as a woman who keeps her mouth shut. My husband's at home and he's watching and he's probably like, yes, that's right. And I'm okay with that, right? Because every day we get to show up and we get to stand up and we get to advocate even when our voice shakes, even when we're scared, even when we don't know what the outcome is going to be. Because if we don't stand up, then who? Who's going to stand up for us then? Right? We get to make the changes. We get to make the difference. And I know that I don't stand alone in this. Right? This is very clear by the people that are here, by the people that are watching, and I know that I don't stand alone even when my voice shakes, even when I'm scared. Today we rally for those that we've lost, we rally for those that are still suffering, we rally for those that are seeking recovery, that are seeking something different. We rally for me, we rally for you, and we rally for all of us together. So thank you guys for being here.
Thank you, Mercedes. That was amazing. And one of the most amazing things about watching Mercedes speak right now was just watching the audience, and I'm going to pick on a particular member of the audience, if that's okay. So Representative Watkins was in the audience, who is Mercedes representative and was probably cheering the loudest. So Representative Watkins, if you want to come up and just say a couple words, if that's okay. I know I'm picking on you, but we know that you've got a great bill going on this legislative session, and we want to hear all about that bill.
Well, thank you. Was not expecting this, obviously, but wanted to support Mercedes because we're out there kind of in the hinterlands, and so we get our act together and we keep supporting each other. I filed a bill this year to help with medically assisted treatment for people who want to kick their habits or find a different way to function in life. We have a great program going on in Carbon County. We work with our sheriff, we work with our medical people, and obviously all of the people that are on the signs behind me, but not everyone has that. So what my bill is going to do, and we're going to be working on it, is that all jails, county and city, if someone is in a program and for some reason, like they forgot they have a warrant out for them, they end up back in jail, that we can go in and continue their treatment. There's no need for people to suffer. There's no need for people to die just because of going through withdrawal or the things that you do. I've never done drugs. I almost have to apologize because some of you have, but I will tell you, I had a son involved in that world, and I lost him a little over 4 years ago. And part of it was an inherited thing, part of it was something he shouldn't have been doing. And so I joined that club of a parent losing a child, and it wasn't fun, but my faith carried me through that. So I can't say I understand, but I work with a lot of people in my community that are either going through it or have gone through it, and I just sometimes just want to just go out by myself and have a little parade and cheer them on. So we'll work on this and we'll see if we can get this done. And congratulations, no matter where you are in life and what you're doing, just for being here. That's so awesome.
Thank you again, Representative, for all you're doing. We really appreciate it. Our next speaker is another gentleman in recovery. His name is Brian Higgins. Brian?
Hello, everyone. I'm Brian Higgins, and I'd like to talk today about the two hardest questions to ask, which is I don't know and I need help. I'm a person in long-term recovery as well. I'm not really sure when that actually happens, but I am getting there because my story does include relapse after relapse after relapse, which is part of recovery. You know, no matter how hard I tried to get sober, you know, it was really just, you know, hitting the stopwatch until I would relapse again. But when I was strong enough to come back and ask those two questions, I don't know and I need help, there was organizations like USARA, like NAMI, and other people like yourselves that were there to answer those questions and help me through. And now I get to stand here in front of you, and I am the executive director of a non-profit that I started called Mental Healthy Fit, which stands for Films, Ideas and Tips, and it's an ideas and advocacy organization that takes stories and communications and helps people tell their stories so that we can build stronger communities. Because a lot of the underlying issues within substance misuse is mental health, you know, and we really got to start as a community, as families, as peers, as friends, as ourselves, to start breaking down the stigma around mental health and knowing that there's nothing to be ashamed about, and all being able to stand up and tell our stories. And it's an incredible journey that I've been on to be able to stand up in front of you, you know, and even make eye contact. Because just a few short years ago, I couldn't even make eye contact with myself in the mirror. But it's, again, great to be here. So as I say, the two hardest questions to ask is I don't know and I need help. But what we also got to do as a community is to understand how to answer those questions when people ask them. And again, wonderful organizations like you, Sarah, NAMI, Mental Healthy Fit, many other people around. So just be aware that when someone asks, I don't know and I need help, try to answer with a smile. Thank you very much.
I get to be on some groups with Brian. I'm pretty fortunate, so thank you. Okay, one of the things that, you know, we had this kind of public health emergency thing over the last couple of years, and I think we all had to pivot and figure out how we were going to continue to reach people. And NAMI was pretty fortunate. We had some really creative folks that figured out how to do our groups virtually. And it's actually been pretty cool because we actually have people from across the country that now attend NAMI groups. And we're fortunate enough to have one of our teachers of one of those groups. I want to introduce Hannah Norton.
Hello, everybody. I am happy to be here and also wildly anxious about it. So bear with me during this and we'll get through this. Music is the way to my heart. I'm also what I didn't know is that I am a survivor. My battle with mental illness began before I even knew the words to be able to describe what I was feeling. I felt different than everybody around me. I felt alone and scared and ashamed and broken. I was hurting in ways that I didn't know a person could hurt. I saw a few therapists and a psychiatrist, but nothing was working. At the age of 15, as a sophomore in high school, things spiraled out of control, and for the first time, I attempted suicide. At that point, the level of care I was receiving increased exponentially. I was admitted to an inpatient psychiatric facility and was required to find an outpatient therapist that I would not ghost. I went through multiple therapists until I found one that I love, and we've been working together for years. Not all of those years have been easy, though. I wish I could say that my suicide attempt sophomore year was the only one, but it wasn't. These further attempts resulted in many more inpatient stays and even a residential stay. I spent the first 3.5 months of my senior year of high school living in a psychiatric facility. All of these admissions, along with the help of my therapist, psychiatrist, and support system, helped me realize my warning signs. They helped me realize that sometimes I can't do it on my own, and that's okay. Getting help doesn't mean that I'm broken. It means that I was strong enough to realize I can't always do it on my own. Yes. Each day looks different for me. Some days I'm able to accomplish and complete huge tasks, and some days the best I can do is simply wake up. Both extremes deserve to be celebrated, and I'm still working every day to realize that my best, despite how it looks in that moment, gets to be enough. Today, I'm able to tell you that it's been almost 4 years since my last suicide attempt. And next month marks 1.5 years without any type of psychiatric hospital admission. Thanks to organizations like NAMI, I've been able to feel seen and share my story in an effort to help other people. Things do get easier. It's hard, but it's possible. Recovery is a journey, it's not a destination, and it's a recovery we can all take together. Thank you.
Thank you, Hannah. That was just truly inspirational. Thank you so much. All right, next up I'd like to introduce one of my favorite people in the world and someone I'm lucky to work with every day, USARA's Executive Director, Mary Jo McMillan.
Well, the feeling is mutual. Well, I'm really happy to see some of us here and others online because we weren't sure that this was going to happen due to the COVID epidemic. And yet, it's still important that we hold the rally and that you all are here and that you are watching live. I'm Mary Jo McMillan. I am the Executive Director of the Utah Support Advocates for Recovery Awareness, USARA. And most importantly, I'm a woman in long-term recovery from substance use and mental health disorder, and I have not used any substances for over 36 years. And the things that I do to help my mental health and wellness and be the person that I want to be truly has been a part of my life for a very long time, but it's taken a lot of support. And with that support and being a person who believes in helping others, I've gotten to be this very grateful steward of this journey of connecting to recovery community. And there's a person I'm about to introduce who, without their support, their vision, I don't know that I would have the job that I do today, that USARA would exist in the way that it does, that we would collaborate with our friends, NAMI Utah, and many other people. This is a person who does things behind the scene, and I think it's important that you know we have a lot of people working with our local government, state government, that really do see us, they hear us, they understand what we need, and they're doing everything they can to fight this every day. So this person is truly an example of a public servant and one of my very personal mentors and heroes. And so I'd like to introduce you to the interim director of the Utah Health and Human Services Division of Substance Use. The name is changing. He'll clear things up. He always tries to do that. His name is Brent Kelsey, and I'd like you to hear from him.
That's pretty tough. What a thoughtful introduction, and I'm surrounded by my heroes. I look at Mindy, Jen, Mary Jo, Nami, and everyone else who's spoken, and it brings so much meaning to what we do. And you're my heroes. My name's Brent Kelsey. I am the director of the Office of Substance Use and Mental Health. We are an office at the new Division of Integrated Healthcare, and I'm really excited for this opportunity. I've worked in this field for about 21 years, primarily on the substance use disorder side, and this work still energizes me, and being here today feels like coming home. Last year, this event was held virtually, and that was fun. It might have been the most enjoyable virtual meeting that I participated in last year, but it's not like being here and seeing everyone in person. So I don't want to take a lot of time, but I want to say thank you. I want to say thank you to NAMI and USARA for this event and for the work that goes on every day in communities all over the state of Utah. I want to thank all of you for showing up, speaking out, telling your stories, and voting. Nothing I can say can change the perception or the reality of addiction more, or mental illness more, than people with lived experience sharing their stories to people who may not have experienced mental illness or substance use disorder. That's what's changing the conversation in this country. We're in a very different place than we were when I started my career in the late 1990s. This might be the most important speech that I give all year. And I say that as a public servant, as someone who wants to be held accountable by you for building out world-class prevention, crisis response, treatment, and recovery supports. We know more about these illnesses today than we ever have. And we're not very good at implementing. And you need to hold me accountable. You need to hold the legislature accountable. You need to hold treatment providers, prevention experts, harm reductionists, and everyone involved in this work accountable for serving the population to the best of our abilities. I organize my thoughts around recovery using the SAMHSA definition, but I summarize it in 4 words: health, home, community, and purpose. And I'll tell you right now, if any of you have ideas or thoughts about how we can create opportunities to improve people's health, to improve housing, to bring purpose to people's life, and to create a community that supports people living with substance use disorder and mental illness, I'm your champion. Let's move forward. Let's build a better system here in the state of Utah. We're so far ahead of other states, and a lot of it's because of the work that you're doing. So let's go. It's go time. So thank you.
Thank you so much, Brent. See what I mean? So the next person that I would like to introduce, I met as part of our state division holds what's called a Utah Behavioral Health and Planning Advisory Council, which is made up of more than 50% of us who are people in recovery. I attend as an advocate with an organization so that people with recovery voices are heard. Rob has been the chair of this particular committee. And this last year, well, I would say in 2020, we really realized there were some deficits. And we needed to do some assessment about the needs of the people in the community. And I want to say it was actually the end of the very beginning of 2020, if not, I think it was in 2020. But there was a committee that was developed called Communities United for Racial and Ethnic Integration and Equity. It's called CURRY. And people came to the table on this committee to begin to talk about how we needed to look at all of our counties throughout the state of Utah to see where there were disparities and people who were not being served and not being able to get the resources that they needed. And we have some champions who are working on that, and we have a long way to go. But one of the people who I personally connected with my heart and her wisdom and experience is teaching me about the things that I don't know to be more informed about the inequities that people experience. So I'd really like to welcome an important voice here today at the rally, Martha Mendez.
Can you guys hear me with the mask? Okay. Well, thank you for inviting me. My name is Marta Lilia Mendez, and I am a multilingual trauma therapist and also the founder of Inclusive Minded Counseling and Consulting. I mostly serve survivors of sexual assault and domestic violence in Spanish and English. So I'm also the co-chair of CURRY, which stands for Communities United for Racial and Ethnic Integration and Equity. And I'm here as an ally and advocate for recovery. And I'm also here with the intention to start conversations about who is currently being excluded from support and resources to get to or maintain their recovery. CURRY completed, as Mary Jo just mentioned, a statewide needs assessment to study the current health disparities in Utah's public mental health and substance use disorder treatment systems. Curry, together with the Health Disparities Research Team and the support of Utah Division of Substance Abuse and Mental Health, decided to focus on 4 target populations, which was the youth in transition, Black, Indigenous people of color, the acronym is BIPOC, LGBTQ+ communities, and people with developmental disabilities, who they also need resources, again, to get to or maintain their recovery. And I would like to bring specific attention to the Black, Indigenous people of color communities and share recommendations for meaningful change. Our findings are very interesting and rich in information that's allowing us to create specific recommendations to the state of Utah to be responsive and inclusive of the BIPOC communities. Due to the lack of time, I will only be mentioning 2 findings, but please keep in mind that there's way more we've found. So the first finding is the lack of representation in staff, board members, and in policy-making spaces, so no representation for BIPOC communities. The other finding was approaches to treatment were not responsive and inclusive of BIPOC communities for recovery. Lack of awareness about exclusion and inequity happening to these oppressed groups, BIPOC communities, at their own agencies. So the same staff members, there was some lack of awareness of what was experienced for their BIPOC clients or patients. So recommendations, right? So support and change would look like the following. Include Black, Indigenous people of color in all policy decision making. Ensure evidence, thank you, yeah. Ensure evidence-based practices are culturally relevant and responsive to BIPOC communities. Implement a strategic plan for workforce development. We need that really a lot here in Utah. Workforce development, recruitment and retention by providing mentorship and financial support for BIPOC. These will help ensure a path for BIPOC to become licensed mental health providers or licensed staff, and then increase representation and source of knowledge from the community. You're getting me excited. Yeah. You notice my voice? Yeah. Create relationships too with BIPOC communities to better understand the needs and create a bridge between communities, just creating that common humanity. Show real commitment and show real commitment of leadership teams to understanding biases, stigma, and the history that has helped lead to disparities and has helped maintain them for so long. So just to make sure on that one, real commitment for me, I want to make sure that's personal opinion, would look like taking more than a one-time 2-hour yearly training on diversity and ethnicity, right? Like the history. Yeah. So, there you go. I'm in my page now. We have submitted a proposal, which this is also very exciting, and we're in that process right now. Curry has submitted a proposal based on this needs assessment and the recommendations that we are basing on the needs assessment and what we found. So hopefully this will create change and move forward. And I got very excited about what Brent was saying, like keeping us like, I'm like, what's his name? What's his name? Yeah, that gets me excited because I'm noticing maybe it was the pandemic, right? Not everything that was brought was completely bad, but in my opinion, it has also inspired change and a little more openness and responsiveness. Thank you. So like to know more information about the needs assessment, more information about recommendations, or to even find out more about Curry, you can send me an email at info.curry@gmail.com. And Curry, it's Cureie. Okay? Thank you so much for your attention and energy.
Thank you, Martha. Thank you so much for the work that you do. To introduce our next speaker, I'm going to bring Noella Sudsbury back up. So, Noella.
So Utah is really leading the way with expungement, but our work would not be possible without partnerships. So in town today, since automatic clearance began in Utah today, we have a visitor from the National Clean Slate Initiative, Sheena Mead. She's a directly impacted person, a grassroots organizer, and would love to share her thoughts with you about recovery.
Noella's a rock star. Everybody hand clap for Noella. Give it up for Noella again. I heard I was at a rally. It's a little quiet in here. You know, I came from the South. We get a little rowdy. So when I say second, you say chances. Second. Chances. Second. Chances. Second. Chances. It's about second chances. And when I came out here today, I saw what a community could do when we come together with love, forgiveness, redemption. And I witnessed that in the Supreme Court room today where politicians put people over politics. They thought about the people who was least among us, the people who was at their weakest. Because we know that our community is only as strong as our weakest link. And when we all have been at the bottom, when we all have been in that place where we felt unseen, we wanted that love and support. And so I'm so excited to be here in Utah today. And when Noella asked me to come, I was like, oh, it's a Clean Slate rally? So I was like, okay. And I got the flyer and it was like a recovery rally. So I was like, oh, okay. And I said, well, I wonder what I'm going to share. And I'm going to share possibility, what's possible. Because not only am I an advocate, I'm a wife, I'm a mother, but I'm a wife to someone who's in long-term recovery. So I'm going to share a little bit of my husband's story. And I'm going to tell you what's possible, because I heard Amy's story today, and it was so inspiring. And there's so many Amy's in this audience today who have their own story. But I'm going to share my husband's story. A little bit over 15 years ago, my husband was addicted to crack cocaine, homeless, incarcerated. In 2005, he didn't see any hope. He was standing at the railroad tracks, ready for a train to come to end his life. But God saw something different that day for him, and he crossed the tracks because the train never came. He admitted himself into a treatment facility. From that time, in 2005, my husband has gone to college to Miami-Dade. He went on to get his law degree. Not only get his law degree, give a hand clap. His law degree. And together we led a movement in Florida to restore voting rights for 1.4 million people with felony convictions so they could vote again. But the thing is, that's not the shining, bright part of the story. The story is where he came from, where support, love, and community and being seen, because we all want to be seen. He was able to impact not only his community, but other people who may feel like there was no hope. Desmond Meade, I would say his name as I know you all said names today, recognizing the people who we have lost and folks that we love who is battling with addiction and who we're hoping that come out of recovery. But 2019, he got Time 100 most influential people in the world. This is one of your brothers, someone who has been at the bottom, that knows what it feels like, that wants to have a better and safer community in the household. And I'm just here to say what is possible. Amy shared her story today, what is possible. I shared Desmond's story with you today, what is possible. And so, you know, this is my first time in Utah. I love your mountains. This is the best capital I've ever seen. But you know, I live in in Windermere, Florida, and like right at the end of my street, there's a beautiful Mormon temple that I live next to. Now, when we was driving around, I didn't see many Baptist churches, but I'm gonna take you to church for 2 seconds. So, in the Black Baptist Church in the South, the preacher does something a little uncomfortable, but it's so powerful. I know you've seen it. He goes, turn to your neighbor and say something, right? So today I'm gonna tell you, turn to your neighbor. Yeah, you gotta look at them and tell them, I see you. I know what's possible. Wait, I don't think they heard you. Look at the other neighbor because you're scared of that person. I see you.
I see you.
I know it's possible.
I know it's possible.
And so I just want to say this. A rally is about chanting and getting excited. I'm preaching to the choir here, but I know we got people on live stream. I want our community, our legislators, to know what's possible. So after I do, it's called call and response, because I'm an organizer. I like these hills today, but I used to like beat the streets in my sneakers. So when I do the call, your response is to say possible. You ready? Let's try it out. Recovery. Possible. Families reunited. Possible. Healthy communities. Possible. Fresh start. Possible. We know what's possible for our communities. And I just want to tell you one thing. I was meeting with a legislator in D.C. the other day. And he said he was traveling to Israel. And he's from Utah. And I said, I'm going to Utah. And I said, they just passed clean slate. And we want to pass it in the federal government as well. Like people need second chances. So I said, I told his aide, I said, I need you to tell him a story. And I'm going to tell that story to y'all real quick. So over there they have the Red Sea and the Dead Sea. Anybody heard about it? The kids probably know because they've been to school, right? The Red Sea and the Dead Sea. They're two bodies of waters that are parallel next to each other. But there's a big difference. The Dead Sea, nothing can live in it. There's nothing living in the Dead Sea. But the Red Sea, which is right next to the same body of water, is very vibrant with life and fish and plants. Well, what's the difference? Because they both get the same source. They both are given the same source of nutrients. Well, the thing is, the Dead Sea, it keeps it all in. The Red Sea gives back to another body. So I say this to you today. For the folks who have came out of recovery, who have made it through, who's on their journey, make sure that you do not keep that to yourself. Go back and give back, and we all can have a vibrant community. Thank you.
We have a lot of reasons to celebrate today, but most of all because today is the day that 500,000 criminal records in the state of Utah are going to start to be wiped. So, our next speaker is truly a hero to our community and has saved countless lives through the work that she does. So I'd like to introduce Dr. Jennifer Plum.
Through the end of a long day, which is much appreciated. I don't know how one even begins to follow all of these voices, but I will try to do it succinctly and quickly so that we can get on our way home and get back to the good work that is about living, right? My name's Jen Plum. I'm a pediatrician and an ER doc and a mom and a sister who lost her brother to a heroin overdose in 1996. A lot of minutes ago, but also feels like just yesterday. I have been so humbled and honored to walk amongst you and alongside you and hopefully enough behind you to let you know that you and your lived experience is what really matters here. I keep hoping that one day we won't have to have these anymore, right? Because it'll just be like a celebration of recovery and mental health, wellness and awareness every day. But until then, we'll keep having annual rallies. Like as someone said, my favorite rally, my favorite space to exist. I've been humbled to watch since 2014 when we first got naloxone access laws. I've been humbled to watch folks like every single one of you step up and save the life of someone around them when they were experiencing an opioid overdose. 7,034 times y'all have told us about that, and and that's both humbling and amazing, but also terrifying to me, right? Because that means those 734, if not more folks, almost were gone. And I keep charging forward with the hope that one day they're going to say to me, Jen, we really appreciate the work you've done, but we don't need you anymore. There's nobody dying. there's nobody struggling. There's nobody that needs another voice alongside theirs. And until that time, here we will be at microphones. I don't, like I said, want to go too long, but there is an opioid settlement coming here to this state. You've probably heard about these dollars. We haven't got the exact numbers. We haven't gotten the exact dates. People like myself have gotten a fair amount of concern, though. I want these dollars spent to ameliorate the harms that have been caused by opioids. We can't cut checks to each and every one of us who've lost some money, right? That's not going to happen. But what we can do is do things better, do things directed towards the folks who have been impacted and to prevent further impacts. I need you all to keep your eyes on your legislators. I need you guys to watch when folks start sending money to for-profit institutions. When they start sending money places without a review or a proper application process, speak up and say, wait a minute, can someone tell me why that just happened? We have to keep our eye on folks, right? We got in this crisis because we just listened to the for-profit entity that was Purdue Pharmaceutical and other reasons. I can't blame it solely on them. But while we're here today celebrating this awesome clean slate piece, wouldn't it be great if we didn't get so many people, so many charges on the front end that we have to clean up later? There's a concept, right? Like, I love clean slate. It gives me chills to even say it because it's going to change people's lives, undoubtedly change people's lives in like that. But Representative Lesser is a representative here who's introducing a bill. This is a super simple bill. Take two things off paraphernalia: fentanyl test strips and syringes. Is that big of an ask? Like, legitimately, is that big of an ask? Something that can save your life kind of in an instant moment, like, you know, I have fentanyl. I need to go slow. I need to not use alone. I need to make sure there's naloxone. I need to use test doses. I have fentanyl. And syringes, we've got these syringe programs, which I think are amazing. My organization operates one, Mindy operates one, others operate one. They give people a point of engagement where someone says, you know what? I don't know what's going on with you today, but I'm here for you. And if today it's that you need clean syringes and maybe some condoms and maybe some words of wisdom or just a pat on the back or a hug, great. If next time it happens to be that you're thinking about detox, you know who you can ask and who won't judge you. And if a time again down the road it needs to be detox again, it'll be someone that says, yeah, I've been there, and I'm going to make sure that we're still here for you if you come back again. So these syringe exchanges where we're saving people's lives, I'm protected against getting a paraphernalia charge, right? Because I operate a syringe exchange. It happened, and I would not get a single charge, but one person could have 5, and they need us to show up and tell people who don't know what it's like. Let's be that voice, because folks up here, even with the best of intents and the best of understandings, or thinking they do, they need us to tell them. They need you to tell them. Your voice matters more on some levels than mine. Honestly, mine might be louder and more annoying, but y'all's means more. So let's go through the rest of this session using our voices with respect and compassion and heart, and teach people what they need to know. Let's stop giving people charges where they don't need them. Let's get opioid spending where it will help people. And let's keep moving forward. I don't think there's any room for something called a drug-induced homicide bill to be up here right now, but there is. And I need y'all to speak up about that. Please. Thank you so much for trusting me in this space and welcoming me in this space, and for all that you are. Get yourselves home safe.
Thank you, Dr. Plum. So we've talked a little bit about some things maybe that don't go so well up here, but we have someone who we're very fortunate to have who understands what needs to happen up here. And to be perfectly honest, when I see the amount of work that this gentleman does, I don't know how he does it. I suspect he doesn't sleep. I mean, I think he routinely has more bills up here, and they're the ones that we want. You know, improving access to mental health, etc. I mean, it's just fantastic. So I will shut up and introduce Representative Steve Elison.
Thanks, Rob. True story, last night I finished one call and they said, I'll call you right back. I laid down on the floor in my suit, and in about 30 seconds I was out. missed the return call. My son comes in later, Dad, are you okay? So I get to sleep one way or another. So thank you for being here today. If you or your family has not been touched by addiction, then you're a very rare person. Let me share one story that's motivated me. My cousin, who grew up down the street from me, has lost all of her children to overdose. And I don't want those deaths to be in vain, or the deaths of so many friends and family and loved ones that I know many of you have also. This is my 12th session up here, and thanks to many wonderful advisors and clinicians like Dr. Jennifer Plum. There she is back there. I thought she was hiding. Okay. We've gotten some great things done. I'm happy, but I'm not satisfied. Exciting thing that will happen that started here in Utah. On July 16th of this year, you can call 988 to reach the Utah Crisis Line instead of the current 1-800-273-TALK, which is, I barely memorized that myself. We're going to put mental health on parity with physical health in terms of 911. That will go nationwide this July, thanks to efforts that started here in Utah. I have a very exciting update. Several sessions ago, I sponsored HB 32, put historic funding into mental health and substance use disorders, and is creating a statewide network of crisis receiving centers that will be, thank you, that will be no refusal, 24/7, 365, regardless of ability to pay. And the crown jewel of those 4 receiving centers that will be from across the state will be here in Salt Lake County. This is now public, but the 9 acres between the county jail and the Men's Homeless Resource Center in South Salt Lake will become the Campus of Hope, an almost $50 million facility where instead of going to jail next door or an emergency room with a costly bill, individuals can go to the Campus of Hope, which will be a mental health and substance use disorder emergency room where people can be treated with kindness, compassion. They can stay up to 23 hours. If they need to stay longer, there will be subacute inpatient units. And we'll have the Bridge Clinic for individuals dealing with opioid use disorders, as well as a host of outpatient services. So people don't just get kicked to the curb when they come in for a one-time visit, but there'll be a pathway of care once they exit. So there's just yesterday, maybe the day before, in the same rotunda, the American Foundation for Suicide Prevention had a rally, and I was able to talk about 6 different bills that I'm running this session related to mental health and substance abuse. I'm not going to bore you all with the details right now. Some of them are pretty technical, but very important. I will tell you about one of them, HB 13. It has now passed the House, full House, a Senate committee unanimously. It just needs to have the final reading in the Senate. We'll create a new special group license plate that I'm going to encourage all of you to sign up for. It will be the Live On license plate bearing the Live On logo. It'll be, the funds will go to the Governor's Suicide Prevention Fund that'll help fund the Live On campaign. I'm sure you've seen the billboards, the social media messages, the TV commercials that talk about life is worth living. Let's watch out for one another. And let's get through this together. So that license plate and additional funding for that awesome campaign should be coming, get passed here soon, and I'd encourage you to sign up for a Live On license plate. So thank you for being here. Please know who your representative and senator is. You can go online to la.utah.gov, who represents me. Let them know that these issues are important to you. Tell them your name, your phone number, that you live in their district. Call out specific bills, and you can make a huge difference. You'd be surprised at how few individual constituents that live in my district actually contact me about an issue. I get, I don't know, my interns hear thousands of emails in the course of a week, and extremely few are from constituents. So when you email or contact your representative or senator, tell them you're a constituent. I live in White City, I live in Cottonwood Heights, I live in Sandy, wherever it is you live in their district, and then tell them this bill's important to me, and tell them why your voice can make a difference. Thank you.
As I'm sure that many of you know, we have a part-time citizen legislature here in the state of Utah. And so our legislative session only lasts 45 days. It is a short period of time compared to the rest of the year, but it is truly a marathon. And one of the people that I know that does this best is our next speaker, Representative Ward.
It's always a little intimidating to go after Representative Eunice, and I feel good if I've done about 1/10 as many things as he's done. He's been an inspiration to me in my time up here. But I did want to tell you about a couple other good things that I know are going on. In social services, this year, talking about substance abuse and how to get the right treatments was one of the things that we really talked a lot about. We talked about making it just standard practice so that medication-assisted treatment could be part of treatment for those who are incarcerated. We talked about increasing the rate that's paid on Medicaid for dispensing medication-assisted treatment so that those providers can afford to do that and provide that service to people. And we started talking about how to put this opioid settlement money to its best good use so that this one-time, fairly large, but one-time infusion of money that the state gets can really be put to make a difference in the opioid epidemic and this scourge that's been on all of us with all the lives that's been ruined, that we can take. It's just a pile of money, but that we can turn it into an outcome that we can measure, that we can see things doing better. And especially, I think the first area we're going to focus with that is pregnant women who have substance use disorder, to make sure that during their pregnancy they have peer support, that they have a licensed clinical social worker, that they have home visits, going there to find out what else in their home is making it hard for them. And the thing that makes me so happy about that is that we're looking at that not just as during the pregnancy, that's up until the infant turns 1, right? I have one other bill that I feel very good about. I'm very happy that passed the House floor today on a unanimous vote, and that's about our State Office of Debt Collection. Many times those with difficulties with substance abuse have criminal charges, and that results in debts that go to that office with fees that just pile up and interest that piles up, and a structure that is so confusing that it's very hard for the person to do what they want to do, which is to get back out from under that. And this bill would make it so that office has to let the person know and have it online so they can see who they owe the money to, what the interest rate is, how much they have paid, where it has been paid to. So all that information is available to them. And most important, when that person comes to be able to settle a debt, in the past the state office wouldn't let them settle it sometimes. They'd say, well, you have to pay to all of them equally, but it gives it back to the debtor to say, if you can settle one, that's our priority. You can settle it, you can get that part of the monkey off your back and carry on. Thank you for being here. I look forward to hearing from you one at a time with whatever we can do to help. You're the best.
All right, I've got the pleasure of introducing our last scheduled speaker, so we're almost done getting here to the home stretch. He is truly one of the heroes in the recovery community, but in the community at large. I'd like to introduce Sean McMillan.
Hey everyone, I'm going to take a moment of privilege. I only have like 4 minutes, so I got to be fast. So, the elected officials that you saw come up today, they are your allies. They are your allies. And they talked about pieces of legislation that they're working on that are very important to them. And Representative Elias had mentioned that he actually has a personal reason why he's focused in this area. That's a great privilege. I didn't know that about Representative Elias. So you can see that you have allies. You have other allies. There's a couple of people sitting over here, Liz Kelch and Adam, who have worked on your behalf in these halls for a decade, who you don't know, but they work so incredibly hard on issues that benefit all of us. As I should introduce myself, so as was said, I'm Sean McMillan. I'm the Executive Director of First Step House. I'm also a person in long-term recovery. Stepping onto that recovery path has been profoundly transformative for me, and I have a full heart because I started that walk on the path. So I wanted to say that about our allies, but Representative Eliason also spoke to encouraging you, I thought quite emphatically, to reach out to your elected officials and letting it be known that there are issues that you're concerned about and that you hope that they will give them careful consideration and that you support them. You would like for it to be handled in one way or another. So incredibly important. So what I've been asked to do is come up here and talk about housing. So some of you may know that First Step House, a couple of decades ago, started to develop recovery housing to meet the needs of the individuals that we serve, and that's critically important. In this legislative session, there is some money that has been allocated to support continued development, so financing of additional recovery housing in our communities. Incredibly important stuff. So that's the kind of stuff that you need to let your elected official know about. When I got here this afternoon, former Senate President Wayne Niederhauser was coming down the stairs. Well, Wayne Niederhauser is now the director of the State Homeless Services Committee, and he is advocating for a couple of pieces of legislation that come out of Governor Cox's budget, specifically $170 million to develop deeply affordable housing. Huge. The single largest allocation, all on its own, it would be the single largest allocation for the development of affordable housing, deeply affordable housing in our state. But dig this, Governor Cox also included another $100 million for housing, for affordable housing in rural communities. Huge. So that affects you. And here's what I know, and one of the reasons that First Step House got into the affordable housing development space, and that's because criminal justice history impacts your ability to get a job. Criminal justice history impacts your ability to get a job that pays a living wage. Right? Right. If you can't earn a living wage, you can't afford an apartment, and we all know what apartments are going for these days, let alone a house. So these are all incredibly important. That's why God, I'm blanking on her name. Clean Slate Bill. Yeah, Noella Sudbury. I've known her for a long time, I swear to God. So incredibly important. So incredibly important because that makes it a little bit easier to get a better job. Makes it a little bit easier to get a better place to live. So there's that going on. The other thing I want you to know is that there have been lots of things going on here on the Wasatch Front, in particular, to develop affordable housing. Just in the last 2 years, we've brought online, I think, in the neighborhood of 400 units of deeply affordable housing for seriously mentally ill, formerly homeless individuals. Huge. I don't know how many of you are walking a recovery path, but I'm going to bet that you know somebody who's been homeless. I'm going to bet that you know somebody who's struggled with serious mental illness and how hard it is for them to get things to a point that they're stable enough that they can go through that process to get access to housing. And now it's a little bit more available. It's huge. So, and our allies in the legislature deserve a piece of the credit for that. People like Liz and Adam deserve a piece of the credit for that. Guy right here, Rob Wesselman, deserves a lot of credit for it. But also people you never met, entities within government that you never met. Oh, I need to mention Brent Kelsey. Huge. But like the Utah Housing Corporation, Utah Housing Coalition, these are all entities and people that are working on your behalf to make it a little bit easier to walk the recovery path. Huge. Salt Lake City, Salt Lake County government have brought an incredible amount of resource. So I mean financial resource to the table that has allowed a lot of this to be made possible. And they now need the state legislature to do their part. So that's a reason for you to contact your legislator and say that, hey, affordable housing is important to me. There's some stuff going on in the legislature this year. I would hope that you would support that. You as my legislator, I hope that you would support that. So important. These guys are your allies, so you don't need to contact Representative Eliason or Representative Ward, other than maybe to say thank you, or Representative Dunnigan, huge. So they're deriving some satisfaction for, in some instances, personal reasons for the work that they're doing. But we all need you to contact your elected official, your senator, your state representative, and let them know that you're out there. Let them know that they're there, and that you care, and that you vote. Many of the elections in the state were decided by 50 votes or fewer in the last election at the local level. That's the difference. That's how important it is. I hope I met your satisfaction.
Thank you, Sean. And just one last round of applause for all of our speakers today. So thank you so much, everyone, for coming out to our Rally for Recovery. Just a quick note before we wrap up. The next Rally for Recovery will be next February 16th, 2023. So we hope that you'll put that in your calendars now. And also, please stay in touch with USERRA and NAMI throughout the year. We have plenty of other events and opportunities to engage, but we're looking forward to seeing you next year. Thank you again.